will start the lecture. Today's lecture is very important, especially for you guys as dentists. We will introduce it in a simple words. Today's lecture it's called the typical disturbance of acid, base, and it is balance as well. So the acid balance will be the title of our topic today. What you are supposed to learn, according to today's lecture, first of all, which is I would introduce to identify the disorders. After you will identify and give them a definition of the meaning of them, you will be able also to learn about the causes of each one of them according to the classification what they will be given into the introduction as well. After that, you will be able as well to make to typing them into classifications, and in the end you will be able to make a comprehension according to the disruptions of acid and alkalos as well. Yes. According to the acid base, guys, we always get used to understand for everything, for any parameters, there is an average limit of them. The acid's limits are being measured by the pH. pH is the parameter of measuring the acidosis into the blood. The normal average, it starts from 7.35 into the 7, sorry, here is 7.45, 45, not 44. Less than 7.35, the medium of the blood or the biological liquid will turn into acidosis. As well, if the medium in the environment, blood, any biological liquidations, if it's become more than 7.45, the medium, we can tell this medium is an alkalosis. You can see here that's the scale of the pH can give us the natural or the normal average of it, and as well showing here the alkaline and the acidus. In some other books, they were telling that the 740 is the typical, the best value. Before it starts less than the natural acidosis, and above it starts also as well the natural alkalosis. So it will start like this, But the typical natural value of it 740. Is it clear? Here, blood pH regulation. The pH, guys, naturally will be classified into two ways according to the regulation. First of all, we will start in blood as well in the organisms. Here, I would remind about buffer system. If you remember the equation of buffer, I will write it right now. We will start according to the buffer system as well respiratory regulation and renal regulation, and we will study the relationship, the interaction between those organisms, or let me say systematic, and the role of them to maintain the disorders that appear according to the dysregulation. Yes, buffer system, it's a binding, if you still remember, carbonic dioxide with the water. Both of them interact to give what? Carbonic acid with the nitrogen, yes, with the H proton. According to this like natural systematic equation, we will identify the buffer system here. The buffer system can be classified into extracellular fluid and intracellular fluid. The intracellular fluid, it will be also classified or divided into two foundations. The first one is the phosphate. The phosphate buffer system, and it's present into the intracellular buffering system. It's also playing a role to maintain this equation. From also the intracellular system, we have as well protein buffer system, and protein buffer system it will be also like according to hemoglobin buffer system into like the RBC cells, you know. And amino acid buffer system, all the proteins, plasma protein buffer system, that's into the intracellular. According also the extracellular, it will be the carbonic acid as well, participating with the proteins that we mentioned before. Respiratory regulation, we already like when we studied in the normal physiology, we studied like there is two types of regulation, humoral and neural regulation, and here as well there is the regulation of the respiratory system. We will not go further it because it's the normal physiology. It's just like to show you that's the equation how it will start from the water with like carbon dioxide giving like carbonic acid as well. That's the result of it, hydrogen and carbon dioxide. Role of the liver, since the liver like one of the metabolism system. If you remember also in the biochemistry, I will not go further it, Krebs cycle and the regulation of the liver or like the hepatic function of the liver to maintain even for glucose or the glycogen into the blood. Here there is like two information, you may like read it by your own about how could the liver maintain and like classified the result of the glucose into the blood or like into the muscles itself as a carbonate. Here as well, role of the skin to to maintain like with the sweetening, like since the skin is very wide system to produce many of the sweetened glands, so there is also playing a role to release some ions with the sweetening or while we are sweetening. Gastrointestinal tract. Into the gastrointestinal tract, we are like a bit interesting into the like secretion and absorption, since like there is many minerals and as well the water will be absorbed into the GIT, yes, in the gastrointestinal tract. So it's also playing, that's all normal physiology. So far it's normal physiology. It's only like introduction to remind you a keywords. Here we almost like become in our lecture as well. Here there is like two slides, acidus or acidosis and alkalosis. Here guys, in the acidosis type, what we can tell, there is increased bicarbonate formation. So that's the first one, increasing in the bicarbonate. Will give neutralized acidity, that's the one result of it, and as well excretes organic acids. After that, it will be increase the ventilation. When the increase the ventilation, like the breathing will be like more fast, the more giving or like flow out the carbonic acid, yes. So the more we give, like we breathe, the less will be kept into the lung itself. So it will be like lower of the partial carbonic acid. The The result of it will be lowers of carbonic acid into the blood or like in the medium itself. As well in the alkalosis, the like opposite of it excretes from from the bicarbonate. As well, these excretions will reduce the acid excretions into the from the medium. This excretions will like decrease the ventilation. When since the ventilation will be decreased, so more time I will keep the bicarbonates into like my body itself. The much it will be like kept inside, the much it will be raised for the partial carbonic bicarbonate. So it will be like raises the carbonic acid level. That's into keywords about the alkalosis and the acidosis. Here as like classification, the primary classification according to the acidosis and the alkalosis, we will speak about from the acidosis type. There is two: metabolic acidosis and respiratory acidosis. As well, in the metabolic acidosis, it will be due to the decrease into the bicarbonate concentrations. In the respiratory acidosis, it will be like due to the increase in the carbonic acid. Into the alkalosis level, we will also speak about the two types of it: metabolic and respiratory. Here in the alkalosis type, it will be the opposite of the acidosis. So in the metabolic alkalosis, it will be due to the increase in the bicarbonate. That's the first moment. In the respiratory alkalosis, it will be due to the decrease in the carbonic acid. Less carbon, high bicarbonate, it's alkalosis. The opposite is the acidosis. Is this understood, guys? Here there is other basis classification, which is very, very important to know. The base classification, I can tell you like more easy to explain in this picture. Here we have the acidosis into two types: respiratory and non-respiratory. From the respiratory, guys, classification, we have the gas and breathing. Both of them are typically like breathing function or respiratory function. From the non-respiratory, guys, there is three windows can be appear here. The first one is metabolic, which is non-respiratory, yes. As well, exogenous reasons. Let me return to the metabolic. In the metabolic classification or window, we will discuss about lactic acidosis and ketoacidosis, which is very, very important to tell. From the exogenous, when you're taking acid and salicylates, that's one medical productions, as well in the transfusion, other any liquidation into the blood, there will be like non-respiratory reason to make this acidosis or alkalosis. As well in the end, excretory, from the excretions, we spoke already about the gastrointestinal tract playing a role for take and intake for many of the liquidation of biological liquidation, as well for the minerals. Here the renal will also playing a role to maintain and for the classification of those disorders. As well, hypersalivation of blood. We will talk in details about this point of this lecture. Any questions so far? So there's two types, respiratory and non-respiratory. In the respiratory, there's two, gases, blood gases, all the blood gases, as well breathing. From the non-respiratory, and don't forget, in acidosis, there is gases and non-gases. As well in the alkalosis, there is gases and non-gases. So it's both of them having the same classification, Yes? Good. Degree of compensations. The compensations, what does the word compensation? It's like, do you remember when we spoke like about the classification, there is respiratory and metabolic? Those compensations between them, we will have a degree. In this degree, there is a small equation we will speak about, it's delta ratio. I will speak about like in details how you will be sure this patient is like diagnosed with acidosis disorders or like alkalosis disorders with sure concentrations measured. So the degree of the compensations, guys, the first one, compensated degree. You will see like there is a change in the pH during the acidosis. It will be like in this concentrations from 36 to 4. That's that. If you remember when I spoke about like a little bit less, a little bit more. Yes, that's the compensated level. Subcompensated, it will be like according to the acidosis. It will be like from 731 to 735. That's in the acidosis type. In the alkalosis type, it will be like from 745 to 749. That's like as a concentration level of them. As well, we have the decompensated. It will be like less than 7.3 in the alkalosis. As well, like more or equal to 7.5 in the alkalosis level. Incompatible with life in the acidosis type. It will be like around 6.8, as well in the alkalosis 7.7. And please try to remember this one until the end of the lecture. So I will tell about the equation of delta ratio, how you can measure, how you will be sure about this patient. Not only like if you see the measurement of pH is like high or like less, okay, this patient has alkalosis or this patient has acidosis. No, there is like a bit diagnosed to be sure about his measurement. Okay. Here there is also as well, we will discuss the metabolic acidosis, metabolic alkalosis. In the metabolic type or classification. As well, we will recompare the respiratory acidosis and respiratory alkalosis. In the metabolic acidosis, what the causes could be like make. We already, the first moment, we spoke about classification. We say that there's two classification, acidosis and alkalosis. Yes? As well, we spoke about the base classification. Right now, we will speak about the causes. What makes metabolic acidosis, and what makes the metabolic alkalosis. So, in the metabolic acidosis, most of the chronic disease in the renal like disfiltrations, atrophy in the renal, sometimes even for like the hyperstonemia, like too much stones into the kidney. Pancreatic problems also making a problem into the metabolic acidosis. Dehydrations during like diarrhea, vomiting, losing like bleeding as well. That's also playing a role. After the obstructions into the gastrointestinal tract, also making a problem and could be a cause for the metabolic acidosis. Into the metabolic alkalosis, guys, the first reason, the first cause of it could be like vomiting. You know, when you vomit, you will see like there is like acidosis in your mouth, like there is a protons into the mouth. So yeah, you will spilt out the protons. Yes, nasogastric reason as well playing a role into the alkalosis. Excessive intake of antacids. There is like too much medication used for the stomach. Yes, for example, ranitidine, any like anti-beta 2 histamidine medication playing a role also to reduce this or to cause the metabolic alkalosis. Diuretic therapy as well playing a role to cause the metabolic alkalosis. As well aldosterone one like of the causes playing a role as well to make metabolic alkalosis. That's according to the metabolic acidosis and alkalosis. We gave all the causes of both of them. So what about the respiratory guys acidosis? In the metabolic acidosis, we said most of the chronic disease of the renal. In the respiratory acidosis, you can also tell most of the chronic bronchitis disorders. So that also could be a reason. Emphysema, like the emphysema, when you like the patient is unable to breathe normal, so much of the bicarbonate or like much of the gas will be like inside, so there will be like enlargement of the axillary cavity, especially like from posterior to anterior, so it'll be like enlargement, emphysema, into like even changing like in the shape of the abdominal as well to the chest will be changed. So in the emphysema case also there is a chance for the respiratory acidosis. Pneumonia could be like in any pneumonia type, viral, bacterial, fungi. Sometimes it's also playing a role to make acidosis problem. Yes, pneumothorax, one of like disruptions into the breathing regulation as well. Pulmonary edema as well playing a role, even not just only like pulmonary edema in the lower respiratory tract, but even like sometimes laryngeal edema, like even like into the high respiratory tract. Any airway obstructions could be also playing a role to the respiratory acidosis. Severe hypokalemia playing also a role in respiratory acidosis. As well, there is here other other causes. We will not go like further. I just give such an example about it. In the respiratory alkalosis, guys, hyperventilations. We spoke already like hyperventilation, so less than of the bicarbonate. Yes, less bicarb. So during the time could be also a cause of the respiratory alkalosis. Anemia. In the anemia case, what do you think? What's the reason? Like in anemia will be also a problem to the alkalosis.
The decrease of red blood cells.
Yes, it's anemia. It's, could be like deficiency in the hemoglobin level concentration. But what's the reason? Don't forget the hemoglobin binding with the oxygen. Yes. So there is oxygen into the. There will be also deficiency into the breathing. Is that true or not? So that's also playing a role into the anemia reason. Hypotension as well playing a role into the alkalosis. Internal lung disease also playing a role in the alkalosis, respiratory alkalosis. Let me say the maximum of the pulmonary vascular disease playing also a role in the alkalosis respiratory. Yes?
Yes.
Great. If you remember, we already spoke into the classification. There is exogenous and endogenous. What does it mean, like these factors in the exogenous factors and endogenous factors? we can tell there's like in the exogenesis could be like acidus or like alkaline, like substances from the intake, from the external environment. From the endogenesis, we will see like there is physiological factors. There is also non-physiological factors. From the physiological factors, there's like metabolic products such as like for example lactate. Here, from the non-physiological acidosis like factors, for example, we have like low molecular fatty acids. That's one of the factors playing a role. Fermentation to the intestine during the like this biocarbonatrations, as well could be removal of some substances, release of the CO2 like through the exhalations, as well excretions through the bicarbonic acid by the kidneys when it will be like retake it and reabsorb it as well. Excretion like to the proton into the gastric cavity to like be able to digest, as well for deliver food of the oxygenation and hemodynamic state during the gastric. Yes, metabolic acidosis, guys, could be like here can be classified into two types. There will be lactoacidosis. That's from the previous slide we spoke about it, and from the pathogenesis like hypoxia reasons. What could be happen to the cardiovascular system right now? Those acidosis and alkalosis, what could be affect to the vital organs? For example, we will take the heart here as such as an example. Into the cardiovascular system will be a tachycardia. That's the one symptoms could be appear like or like clinical manifestations. We will see like into the patient. Hypotension, the second reason. Peripheral circulatory disorders. When you measure like for example the blood pressure into like the peripheral vessels, will be like abnormality into those localizations. As well here guys, we will see the pH like less than 7.2 accompanied by a decrease in the cardiac output. So that's also one of the acidosis reasons. And increasing in the plasma kinase cause vasodilation and increase like permeability to the vascular wall into the cardiovascular system. Here into the we spoke about the cardiovascular. Here the respiratory system. What will be like cause? The most important point I may tell about the pH. It will be like below 7.2 in this case. Will be like such respiratory symptoms will be occur. I could tell like there will be like dyspnea, as well there will be hyperventilation or like hypoventilation in some cases. Some of the let me say symptoms could be like start with dyspnea, like short and fast breathing, sometimes as in reactions for those disorders, cough or like an ability to breathe as well. From nervous system disorders, it starts like let me say depression into the central nervous system can be appear pre-coma, such as stupor level. You know, in stupor level, it's not like totally coma, but the patient cannot like give any reactions. He could like has an emotional reaction, but he couldn't like speak as well. So one of the clinical manifestation or clinical disorders according to the central nervous system, pre-coma. Yes, kidney will be like developed to the oligosaccharides and most of the carbonates. We will speak about them like in details after like this introduction to the clinical manifestation. Gastrointestinal tract. You know, guys, I will just tell one example because I believe it's like a bit important. Into the cells, let's be like this cells, and that's sorry, not calcium, but sodium is not like the most important ions we could speak here, like because it's intracellular. Proton will be shifted into the cells as well. Proton will be shifted to the cells, and as well, sodium will be also goes cellular, so it will be like appear in acidosis cases. But into the alkaline causes, as well, here we have a cell. We have magnesium as well, potassium and calcium, sodium as well. Proton will be shifted into the cells as well. Magnesium will be like excreted out the extracellular. Potassium as well, except the sodium will be bind with albumin, and in this case will be like also making a problem into the pancreatic level and so on. I will not go for the details, but just for your information. Yes, main consequences of acidosis. Okay, for to the respiratory system, they will be like violation of cardiac contractility. This disorders will be affect to the cardiomyocytes. Will like make a disorders to the contractions of the cardio muscles. This disorders will also making a causes to the cardiac output, cardiac rate, even like make hypotension in this case. Into the respiratory mechanism, they will be like hyperventilations, too much breathing, hyperventilation, as well decrease into the respiratory muscles. You know, the extra or like let's say accessory muscles, especially for the intercostal muscles, external type, because of the hyperventilation, too much breathing, muscles will be in cause of fatigue. Yes, so also will be like an increase of the capacity of the breathing muscles. Here, you know, those fatigue will also increase the resistance to the pulmonary artery in this case, as well will decrease the renal hepatic blood flow because the respiratory system occupied the much amount of blood during this operation. For the metabolic disorders will be like insulin resistance. We spoke about like right now the proton will be shifted into the cells, as well calcium will be bound with the albumin, making a little bit resistant to the insulin, so glucose level will be increased into the blood circulation. Yes, inhibition of ATP synthesis because like too much overwork. Hyperkalemia will also be a sign manifestations. Increase in the proteolysis. Proteolysis, the hormone which broke down the protons. Yes, according to the central nervous system, into the medulla oblongata there is like a center which ventral and as well dorsal breathing center will also make like consequences to this central regulation, as well in this case will be like incapacity to breathe regularly, which make as well alkalosis and acidosis. Here in the main consequences of alkaline or alkalosis into the cardiovascular system will be a spasm of arterioles. That's one of the consequences. The coronary feeding to the heart will be decreased into this level. As well, they will be like arrhythmiasis, will be arrhythmia appear in this case. Into the respiratory system, guys, hypoventilation will be like not too much breathing, but the respiratory rate will be decreased as well. Will also appear and metabolic problems, will be activation of anaerobic glycolytes, will be also hypokalemia, which making like a decrease in iodine calcium levels because much of the calcium will bind with the albumin in this case. To the cerebral, like according to the cerebral level, will be like decreased cerebral blood flow, so like less blood feeding to the brain. As well, there will be like delirium and stupor, pre-coma signs. Here we will speak about symptoms of acidosis, symptoms of alkaline. How you can identify acidosis. Yes, here in this picture we will divide it two. This is acidosis and this will alkaline symptoms. Into the central nervous system, the patient will come with, please. The patient will come with a headache. Pay attention, please. As well, disorders like unbalanced sleeping, confusions can be appear not according to the like central nervous system, and pre-coma. Sometimes, like in a total coma, if the patient like not treated in the perfect time. According to the respiratory system, guys, there will be like shortness of breathing, as well coughing. One sign as like a reflex from the brain to the nervous system to make like too much breathing, so less than of the carbon dioxide. Into the heart, there will be arrhythmia. That's the one sign, as will be increase in the heart rate because like of high breathing. To musculoskeletal system will be like seizures and fatigue, weakness according to the muscle. In the digestive, could be like diarrhea, vomiting, and nausea. Nausea like something like you cannot eat, just like you have turning unbalance into the in your body. That's according to the acidosis. Do you have any question? Is it okay? Great. So let's discuss right now, guys, the symptoms of the alkalosis. Here we spoke about the central nervous system. The first one will be like confusion. Pre-coma symptoms also will be appear, especially the stubborn degree, because in the coma levels to start the confusion. After that, it will be like stunning, from stunning sober to the coma. So the stubborn like level here, pre-coma, before the final results of like and consequences. To the peripheral nervous system, will be hand tremor, shaking, and as well the facial reaction will be also could be affected as well in this case. According to the musculoskeletal, will be twitching as well, will be spasm into the muscle itself, and ability like it will be reduce the irritability and flexibility of the muscles. According to the digestive system, will be like two signs: vomiting as well, nausea. Here the purpose of this class, it's very important to know. Before I will explain this table, please pay attention about those notes. This sign is like less than indicator, greater than, it's indicator to an increase. As well, I guess you know it, the sign like decrease, indicator of decreasing. The F is like causative factor. You will see it like here, you know, and as well like in this one. Sign C, like sign C, compensatory changes. As well, W without changes. Type of acids like non-gaseous acidosis, because we spoke there is two types, gases and non-gases, yes, breathing or other disorders. Here, according to the acidosis, non-gaseous and gaseous acidosis, non-gaseous alkalosis and gaseous alkalosis, yes. Here you will see like the blood pressure and sufficient pressure and primary elementals, as well varietal carbonic acid, the pH level, and as well ammonium sulfates, what will be happen to it, and the pulmonary ventilations. And that's it for today, for today's topic, according to the acidosis and alkalosis. Very important to understand it. I hope so that it will be like useful for you, since you are like in a dental student. Do you have any question, please? Mm-hmm. I believe that in class you will have an experiment to see, as well to measure the pH.
Okay.
Mm-hmm.
Sounds good.
Okay. Yes.